Thank you, Marisol and Peyton. Thank you so much. I also want to say a special thanks to Sandy and Lonnie Phillips. Thank you so much for not only being here, but for what you have been doing for all of these years. And I'm halfway through the book that you just mentioned that you were so kind to send to me. Thank you so much. And I also want to thank all of the presenters today, because if the last couple of hours weren't inspiring and motivating, I'm not sure what would be. And to have, as I said at the very beginning, to be in a room with a group of people that are, so committed and doing some spectacular work in their own arenas is just absolutely wonderful. We have had in the room today about 50 representatives of health systems and about 50 representatives of various associations. And, the future always begins today. So lots of great work has been done. So everybody that's been working on this for an awful long time deserve an extensive amount of praise and thanks. But the future begins, because what we do tomorrow is what really makes the difference, and the tomorrows after tomorrow. And if we can just sit back for a moment and imagine what can actually be done if everybody really works together. In the healthcare field, as was being mentioned by many presentations here today, if you look back over the years of some of the things that have been accomplished at one time were thought never to have been possible to be accomplished, they were done. And this can be done also. We can make an extraordinary difference. We just have to imagine it. And we have to believe in it. And we have not to be caught up, as Mark mentioned earlier, in a culture of fatalism. There are good things happening out there. There is progress being made. Some of our leadership and others may not notice it yet. Some may not be participating in it yet, but these things take a long time, as was evidenced by some of the other issues that was discussed about up here earlier. So let me raise a couple of things of what can be done. One is that this meeting not end here, that we all agree and commit today to continue to work together. Because while many people in the room know each other, many others don't. There's a larger constellation of people here today than have been in a room like this in the past, at least in this region of the country. So if we continue to agree to work together, share information, share best practices, connect with one another, sign the call to action. I'd ask everybody here to sign that. And for the representatives of the systems that are here, please sign it. Don't worry what your CEO says. Ask for forgiveness, not permission. Go back to your CEOs and say, have the courage to stand up. I have been a little frustrated with the inability of many health system CEOs to agree to stand up and talk about this issue. Why? You can come up with your own reasons. But it takes some courage. No, it doesn't really. Doing the right thing should never take courage. Dealing with a health issue that is so as pronounced as this one should never take courage. It should take commitment. It should take belief systems. It should take compassion. It's why you're in the role to begin with. So I ask all health system CEOs out there, you can't be silent anymore. not an issue this big. And big systems are getting bigger. Big systems represent the bulk of healthcare delivery. If you had the courage and the strength to run a big system, you should have the courage to stand up and talk about this. My goal is to get all of the major health systems in the United States to sign a call to action, not to hide. And I've personally spoken to some that have told me that they're very reticent. That we have to change. Why they're so reticent, I don't know. I can come up with excuses, but it's in here. It's what you believe. If you believe in it, do it. There's another thing the health system should do. What would happen, and I was listening to the meetings and the discussion, what would happen if 30 to 40 big health systems each put in $1 million for research? Northwell will commit $1 million for this. I will put a challenge out there. I challenge other systems to match it, including all of the other systems in New York. Stand up, put $1 million up. That is more money than has been, if we get 30 to do it, that's a larger number. So let's try to make that happen. And for the representatives of the systems that are here in your room, go back and tell your CEOs this. As a follow-up to this, I would hope, and what we will try to do, with the help of everybody here, is maybe create some working groups from this group around various topics, whether it's advocacy or prevention or whatever. Our staffs will work on that. And then we will hold a meeting like this again a year from now. And then have those working groups present what they have accomplished. There's phenomenal leadership in this room. Let's come together and do something special. And as was mentioned earlier, this is our lane. I've got messages from the NRA asking why I would do this. And I don't claim any special thing about doing this. This thing to me is what's natural. This is what you do. But they said, stay in your own lane. My answer to them is, this is our lane. When somebody gets shot, they don't call the NRA for help. They don't go to an NRA trauma doctor. But as was also evident up here from some of the messages, gun owners also support a lot of what was said up here today. So that coalition is important. So I just want to thank you all for being here. Thank you all for your commitment. And this time next year, let's talk about what we have been able to accomplish in the meantime. Have a great day, guys. Thank you so much.